Well, a group of Senate Republicans are making another attempt at passing a health care bill that would repeal and replace the Affordable Care Act. The new plan would do away with many protections offered by the Affordable Care Act and give huge block grants to states. And similar to previously failed Republican efforts, it would cut back Medicare and let states charge higher prices for pre-existing conditions.
If you believe repealing and replacing Obamacare is a good idea, this is your best and only chance to make it happen, because everything else has failed except this approach, which will work if we get behind it.
But skeptical Republicans who voted against the previous bill are still unsure. Republicans need at least 50 votes with a tiebreaker vote by Vice President Mike Pence in order to pass the bill. Now, the CBO is not going to score this before there is a vote. Now, there are a couple of committees that said they are going to have at least a hearing, but are they real hearings? The answer is no. You also have Senator John McCain, who is blasting Republicans trying to force this through without any real debate as well. What is going to be the impact on people of color? Joining us right now from New Orleans, Dr. Corey Hebert, CEO of Community Health TV, Chief Medical Editor at WDSU NBC TV there in New Orleans. Corey, it's very interesting that you have the top health official in Louisiana going after Louisiana Senator Bill Cassidy. This is called the Graham-Cassidy bill, and people in Louisiana are saying, how in the world are you going to get by, how are you going to co-sponsor a bill where you're screwing your own constituents in Louisiana?
Imagine that, right? I mean, the whole concept of Bill Cassidy trying to do this is all about him being a new senator and trying to make a name for himself. But regardless of that, we know that the governor of Louisiana actually expanded Medicaid, and the states that expanded Medicaid are going to be hit the hardest. But the states that are getting the most money really are Massachusetts, California, Maryland, and New York. And with this new repeal and replace thing that they have, which is worse than the other one, that means that those big four states are going to lose a lot of money, and those smaller states that didn't actually expand Medicaid, meaning like Texas, Mississippi, they're going to get more money. So it's going to spread it out unevenly, for lack of a better term.
Now, what's interesting here, again, March of Dimes, American Cancer Society, a host of health organizations are against this bill. Republicans in the Senate won't even meet with these groups. These are non-partisan groups. These are groups that are not Democrat or Republican. They are about the health of Americans. They won't even meet with them.
Right. Well, the reason why is because they know what they're doing. This bill is even going to, take away the funding for Planned Parenthood. It's going to, it's not going to eliminate the pre-existing illness mandate, but what it is going to do is say that if you're going to get a big block grant, each state is going to get a big chunk of money, and then they can basically do whatever the hell they want to do, right? And so with that, they can say, well, if you have cancer, that's going to cost a whole lot of money to treat. So we're going to make it so that you can't afford the insurance. So we're still offering it, but you can't afford it, which de facto means that you can't pay if you have a pre-existing illness. Also, HIV, things that disproportionately affect the African-American community. I mean, we know that, but like I said, if white folks get a cold, black folks get the flu. You said it a million times. So we know this coming, so we have to make sure that these senators don't do this. I'm scared about McCain because, his boy, who is the governor of Arizona, he was just like, well, I'm not going to do it unless my boy does it. Now his boy, the governor, is saying he's strongly supporting this. So you know what that means, man. I'm nervous about this. I really am. And then it's got to go back. Don't forget, if it passes the Senate, it's got to go back to the House, and the House already passed it, so we're done. Remember
the head of the Freedom Caucus has already made it perfectly clear. If the Senate passes this, they're going to pass this in the House and send it to Trump to sign.
Exactly. Remember that? I'm just a bill. Oh, yes, I'm only a bill. You better go back and hear that schoolhouse rock, because that's what's going to happen. And I'm nervous about it. But we gotta stay strong and lobby so that we can make sure that the few senators that we do have in our corner, they do not flip. And we got to get to McCain as well.
Attorney General Eric Schneiderman of New York said under this bill, folks with a form of cancer will pay $142,650 more a year to get coverage.
you better recognize, and you got to remember this, that the #1 cause of African American people having bad credit is delinquent medical bills. So this is serious, man. I mean, this makes a difference whether you can buy a Honda or Mercedes. It also makes a difference of whether you can buy a house or not because of your credit. Because if you don't have insurance and you break your leg and have to get pins and screws in your ankle, that's 15 grand, and they're coming for it. And, you know, with the Medicaid expansion, that's 15 million more people that had this type of insurance. Now, the CBO won't actually score this one, but we know it's going to be at least that 15 million, if not more, probably closer to 20 million that won't have insurance after this debacle, if it actually does take place.
All right, Dr. Corey Hebert, we appreciate it. Thanks a lot.
Thank you, brother.
Let's go to our panel now. Avis Jones-DeWeaver, leadership strategist. She also is the author of the book, How Exceptional Black Women Lead. Cue the book, show the book, show the book, show the book. Got to sell the book. Thank you very much. We got to be quick. We got to be quicker showing the book. Yeah, you do. I'm the one who told you to also stop not having in the introduction. George Farrell, founder of Black Pack and author of Success is Colorblind. We ain't got his book.
Cue the book.
And we don't have it. Next, you can learn how to send it. Lila McDowell, political strategist and radio host, Magic 195.9. So, Avis, again, what we have here, Republicans having to be taught a lesson again. Defeated in the House, defeated in the Senate. Now they want to sneak it through again. How shameful to listen to Senate Majority Leader Mitch McConnell talk about, oh, how Democrats, how they passed the Affordable Care Act and we had no input, even though 350 amendments were accepted with the Affordable Care Act from Republicans, and they want no debate, no discussion, no hearings.
Absolutely. I mean, McConnell has zero credibility anyway. This is the person who, when this country was under a historic economic crisis, said that his first priority was to make sure that President Obama was a one-term president. So he's never put the needs of the American people first politically. And we're seeing the same thing now in terms of health care. The Republican Party, they don't care that it's going to cost people over $100,000 to get treatment if they have cancer. They don't care that it's going to bankrupt people. They don't care that people will die when they can't get the services that they need. All they care about is to get this notch in their hat of being able to say that they defeated this bill because this was a law that was passed through a black president.
George, you defending this?
I'm defending the tax cut that will go from 30 to 15%, which will put more money in people's pocket, especially if you have $15 an hour. I think that's part of this health care ban. I'm defending the part that the IRS is not going to be involved in future health care planning for people. And I'm defending the part that you're going to get large block grants that will allow states to make decisions as to where health care will go.
So are you defending how it's going to cost you? Are you defending how it's now going to cost you? You have a certain form of cancer, $142,000 a year for coverage. Are you defending that?
I'm not defending that.
But that's in the plan. That's the plan.
But you're going to have black packs, not black packs. You're going to have block grants that will help defray the cost of this health care that will go direct to the hospital.
Let's just be real. Block grants have never been a good thing for black people. What happens when you have block grants? When you have block grants, this is what happens. Then you're in these states where you have you have the large proportion of black populations. In those states, those particular legislators tend to be a lot more punitive in terms of how they spend the block grants when we compare it with states that have a larger white population. So you will best believe that in those states, in one state you'll have coverage for certain things, and I bet you those states will be largely overwhelmingly white states, and then those very same issues will not be covered when you have states where you have a large proportion of the black population. We see this over and over and over again.
So when you have a local state government,
you should not say I have to move to another state in order to be treated for cancer.
Right.
You should not have to do that.
Okay, and the other thing.
One second. Shelley, go to my iPad, please. This is a graph from the Center on Budget and Policy Priorities, which shows what is going to be the impact on the so-called block grants and Medicaid per capita cap cuts. We're seeing that according to this particular health care plan, George, by 2027, you're going to see $300 billion less. So while you're touting how they're going to have the block grants, we're going to see less funding for block grants. And then again, this says that the Cassidy Graham proposal would eliminate the Affordable Care Act's marketplace subsidies and enhance matching funds for the ACA's Medicaid expansion, replacing them with an inadequate block grant that ends in 2026 and will cut funding for the rest of Medicaid by converting it to a per capita cap.
It's not a perfect bill, but it's a start. It's a start. And you're acting like this bill will stay in place for years and years. I'm sure they're going to go back and it's going to be revisited within a year or 2 years.
So here's the deal, though. If you want to revisit something, and if you believe there's a problem, why not revisit the Affordable Care Act?
We're going to repeal Obamacare. We're going to repeal it, and then we're going to put something else in place. But it gives us time to do proper hearings.
Lila, you hear what you just said?
Yeah.
They want to pass a bill and then have hearings.
And right. I mean, it makes no sense. And the thing that we forget sometimes, these are real people, real lives.
These are real people.
Real people, real lives. So now if I'm a woman that was sexually assaulted, I might be in a state that decides it doesn't want to cover pre-existing conditions. It can now do that under this bill that's being passed. Under this block grant where basically it's a gift of money to the states to spend however they want. They can decide and will decide, as we've seen in the past, you know what, we're just not going to cover that, and we're not going to cover these people, and you know what, we're going to give them less money, and we're going to gut Medicaid. And it is so cynical. You know what's so cynical, George? Yes, we do. Yes, we do. It is so cynical because it goes into place right after the election.
Yes.
Why is that? Because many of Trump's constituents, poor working class white folks, will also be impacted.
Let me read this.
So,
let me read this. Let me read this. George.
Yes.
From Vox.com. The proposal will eliminate the health care law subsidies for private insurance and end the Medicaid expansion. Shelley, go to my iPad. States could allow for waivers that let insurers charge sick patients higher premiums and stop covering certain benefits required under the Affordable Care Act, like maternity care or prescription drugs. The health insurance marketplaces will no longer exist as they are envisioned to continue under other Republican proposals. The federal government would convert some, but not all, of that spending into a lump sum payment to states. States could choose to spend this money on providing insurance, or they could use it to fund high-risk pools or do other activities to pay the bills of patients with higher medical needs. States wouldn't get this money for free. They'd be required to kick in a small percentage themselves. It has not been scored by the Congressional Budget Office, but analysts who have studied Cassidy Graham estimate it will cut deeply into federal funding for the health law programs, likely resulting in millions of Americans losing coverage. So you're saying by supporting this bill, you support millions of Americans losing health care coverage?
No, I do not. I support.
But if you support the bill,
not funding
that's the
Planned
result.
Parenthood. That's important.
No, George, if you support this bill, you support millions of Americans losing health care. The result of the bill is millions of Americans losing health care.
Roland, there will be a second bill. You're acting like this is going to be the final bill.
They haven't even read the first one. George, here's the problem. You're already promising there's going to be a second where they haven't had the first one, and there have been no hearings on the first one.
This is a close bill. It's 50-50. The vice president's going to come up.
Y'all, I got to go. I got to go. Call yours. Pull the number back up, please. Pull the number back up. Call 202-224-3121 and tell your U.S. Senator they bet not vote for this bill. If you won't have any hearings and you won't even discuss it, you shouldn't be voting on it. Simple as that.
Weekdays on TV One.
I will never lie to you.
Oh my God.
Roland Martin.
He doesn't want to talk to us. He wants to ignore us.
Uncensored.
Hell no. That ain't gonna cut it, boo.
Unapologetic.
No, that is fundamentally false. You are wrong.
Unfiltered.
He wants an America where we all look alike. He ain't talking about black people.
Unrelenting.
You better go work out, because you got a fight on your hands.
NewsOne Now with Roland Martin. Weekdays at 7 a.m. on TV One.